an effort to make COVID-19 testing as widely accessible as possible, over the past few months, the FDA has granted emergency use authorization to a small number of at-home sample collection kits for COVID-19 testing. Patients can buy these kits with a physician's order, collect either a nasal swab or a saliva sample using the kit, and then mail this sample to the laboratory for PCR testing. The biggest advantage of these kits is that they could reduce the number of patients going to testing sites, which could in turn reduce the risk of healthcare workers contracting COVID-19 and help conserve PPE. However, lab experts also worry that at-home sample collection could increase the likelihood of inaccurate test results, which could lead to patients not getting treated properly and/or failing to take the appropriate precautions to prevent the spread of the virus. So what are the reasons behind this concern? Before I get into that, I do want to say that almost all of these at-home sample collection kits are offered by reputable labs, and we at AACC are confident in the ability of these labs to perform PCR testing for COVID-19. What's concerning about self-collected samples is that even though home kits are designed to be quite simple, there are still problems that may occur with self-collection that can affect the quality of the sample, and a compromised sample can impact the quality of these test results. For example, most of the home kits instruct patients to collect nasal swab samples, also known as anterior nary samples, which are less invasive and not as technically difficult to collect as standard nasopharyngeal swab sample. However, patients still have to swipe the appropriate part of the nasal passage and collect a sufficient volume of the nasal secretion. On top of that, to ensure test accuracy, patients must also handle the swab so that the sample is not contaminated. For instance, they can't touch the tip of the swab or place it on an unclean surface. When companies develop test kits of any kind for at-home use, they perform studies to show that these kinds of human errors don't significantly impact the accuracy of the test results. These studies have been completed by the major commercial labs selling home collection kits for COVID-19, but the FDA has not publicly shared these studies, which is a cause for concern in the lab community. Additionally, researchers have compared the performance of patient-collected nasal swabs with that of healthcare professional-collected nasopharyngeal swabs. They've found mixed results. Some of these studies show using home-collected nasal swabs have a high rate of false negatives compared to tests using nasopharyngeal swabs, while other studies have shown much greater consistency between the two sample types. Studies looking at saliva, the other sample type collected at home for COVID-19 testing, have produced similarly mixed findings. In a study of 60 people with COVID-19 symptoms, one of the labs that tested home collection saliva samples found 100% concordance between saliva PCR results and results obtained from a nasopharyngeal swab. Other larger studies, however, have found that false negatives also increase when PCR testing is performed on saliva instead of nasopharyngeal swabs. Given that self-collected samples do run the risk of providing false negative results, we at AACC currently advise patients collecting samples at home for COVID-19 testing consult with their healthcare providers when interpreting the test result. As with all diagnostic testing, the biggest challenge in interpreting COVID-19 results is to not rely solely on the test result to make a diagnosis. The test result counts, but clinical context must be carefully considered when acting on the result. With that said, we fully support the goal of expanding access to COVID-19 testing through innovative approaches such as this. Scientists look forward to understanding the performance of these assays as more data becomes available. The information we have about the pandemic and how to manage it is evolving every day. And it's entirely possible that at-home sample collection will become a key tool in managing COVID-19 spread.